In a recent survey of people with moderate to severe plaque psoriasis, about 6.4 million people revealed that while psoriasis appears on the skin, its overall effect on people can go much deeper, having an invisible impact on people's everyday lives. So, are there any treatments that can help change that? Well, Dr. April Armstrong is joining us now with more. Good morning, doctor.
Good morning, Heather. Thank you for having me.
So let's just define psoriasis for people who aren't familiar with it. What are some of the symptoms?
So psoriasis is a chronic inflammatory skin condition where patients can develop these red plaques or patches on their skin, and they can flake and they can also thicken. And for patients with moderate to severe plaque psoriasis, the extent of these plaques are much greater, and they can also involve critical areas such as the face or the hands. The symptoms of moderate to severe plaque psoriasis include itching, pain, and when the plaques get very thick, they can actually crack and cause bleeding as well.
I didn't realize that it was so painful for people. In terms of the survey, were there any surprises?
I think what surprised me was the extent to which people avoided social interactions who have moderate to severe plaque psoriasis. The survey showed that the majority of them actually would avoid situations where they think that new people might be there. They are afraid to being touched or touch other people, so that they are really actively hiding their condition. I think another surprise is the extent to which people are really confused or do not know about their treatment options. Nearly 50% of our patients with moderate to severe plaque psoriasis are really confused about the treatments.
So how would you guide some of those people?
So I would say two tips. Number one is to make sure that you get connected with a community, people who may be going through the same experience. It's helpful to talk to them about your experience, and the National Psoriasis Foundation can certainly help you with that. And number two, very importantly, is to find a dermatologist or dermatology provider who is very experienced in treating psoriasis. The American Academy of Dermatology and the National Psoriasis Foundation, for example, have published treatment guidelines for our patients that include the use of biologics, oral therapies, and phototherapies. And these days, you can go to a physician's office and get a biologic such as Illumia, where you get injections only 4 times a year, and you can see significant decrease in the skin inflammation, in the flaking, and many of the signs and symptoms that I spoke about earlier. It is important to be aware that for patients getting a biologic treatment, while most of them tolerate the treatment really well, a small proportion of them may experience things like injection site reactions, diarrhea, or upper respiratory tract infections.
Thanks for being with us. You're watching The Morning Blend.